The DO.TOWN campaign began with a bang. These are city leaders, representatives from Blue Cross and Blue Shield of Minnesota, residents, and of course the mayors of Bloomington, Edina, and Richfield, grooving around Normandale Lake at the kickoff event in September of 2011.
Over the last 18 months, we've been able to work through the DO.TOWN campaign, which was the combination of the three cities, Bloomington, Edina, and Richfield, to be able to make it a much more public rollout of how to improve the health of individuals. The thing is that many of our health problems with the ever-increasing health care costs have resulted from various human behaviors, some of which can be prevented through doing things such as reducing further the smoking, dealing with obesity, and also improving physical activity.
Providing opportunities for healthy living is not a task with one solution. Here are a handful of the DO.TOWN sponsored events we saw take place in Bloomington during the course of the DO.TOWN campaign. All the while, resident feedback was sought. For example, various chalkboards were placed around the city where residents could leave suggestions on healthy living, and a telephone town hall with Mayor Winstead was held. That information collected isn't going to waste. SHIP officials are taking full advantage of that resident input.
SHIP it stands for the Statewide Health Improvement Program, and that is funding from the state of Minnesota Department of Health that the city of Bloomington has been receiving since 2009. DO.TOWN was designed to be, in some ways, sort of an overlay to the SHIP work, and it provided a greater level of visibility within the community. One of the big outcomes of DO.TOWN is that we now have a database of over 1,500 Bloomington residents who are particularly interested in creating a city that supports healthy living and healthier lives for them. Another piece is that a bike advisory group got started, which is made up of Bloomington residents who are interested in making Bloomington a more bike-friendly city.
To continue to spread the word about active living, we created a segment where we demonstrated some fun activities in Bloomington. Whether it be canoeing at Bush Lake, mountain biking in the Minnesota Valley National Wildlife Refuge, or snowshoeing at Richardson Nature Center, we checked many ways to stay healthy off our to-do lists.
And we will continue to do things that will enhance the behaviors. We're currently working to update our alternative transportation program. SHIP 3 is coming along. We're looking to expand community gardens. So there are a number of things that we will be able to do to advance this. DO.TOWN was an 18-month program. It was a step in the process towards an ever more sustainable community.
And as the door on DO.TOWN closes, more are set to open in Bloomington.
We will continue to do many of the healthy food sorts of things, trying to increase the healthy options in our popular sort of venues, as well as in schools, work sites, all of that. Continuing to work on making Bloomington a city where it's safe and easy to be physically active, and continue on a variety of tangents sort of to prevent tobacco use and excessive alcohol use.
Healthy residents make for better overall health of a city, and we're looking forward to seeing Bloomington continue to move towards such a tremendous goal.